Medical forms. They're tedious, annoying, and repetitive. In an age of automation, smartphones, and awesome technology, how on earth are medical professionals still spending hours typing out these dull forms? In a report published by the Australian Medical Association in 2017, it was found that doctors in Australia spend around a third of their time on paperwork and administrative tasks. This includes tasks such as filling out forms, managing electronic health records, and dealing with health insurance claims. So we thought, how might we make health forms and documentation more efficient and user-friendly? Well, EHR Boost's easy-to-use browser extension simplifies these forms to just a few clicks. It breaks down the medical form into two categories: patient data, which can be stored on the user's device and is auto-filled upon selection, and the diagnosis template, which allows you to select a blanket diagnosis such as the flu, and the symptoms, treatment plan, and follow-up instructions are filled out instantly.
The value proposition of EHR Boost is an all-inclusive Chrome extension to autofill health records. What we will do is reduce clinicians' time typing. As they spend less time after work on health records, we will improve their well-being, and ultimately, we hope to help clinics treat more patients.
As our target market is focused on GPs currently experiencing excessive amounts of stress and fatigue from completing work multiple hours after their shift, we see a need where we can help relieve this stress and fatigue and potential burnout being inflicted on all GPs, doctors, and the broader health sector by drastically reducing the time needed to be spent on patient health record documentation. Through our solution, we empower individuals by enabling them to spend more time with patients during work hours. In addition to this, they can freely spend time focusing on relaxing, spending time with family, recovery, and preparation for the next day. Our projected forecasting is calculated using a subscription-based business model, which we will be elaborating on later. So our projection within the immediate obtainable market in Australia at 5% will be around $79,000, purely from GP practices, with an overall projection of hitting $1.56 million after taking 5% of the total Australian health practitioner market. After dominating the Australian market, we plan to spread to the US, where we can expect to hit around 12.3 million at an expectation of hitting 5% of the overall US health practitioner market.
EHR software products are a competitive market. The competition can be segmented into three categories: the legacy companies, niche automation companies, and the largest competitor, Nuance. The legacy electronic health platforms, like Epic Systems, offer minimal time-saving features with many unnecessary clicks when documenting an encounter. Niche automation players, such as Phlebotics, only offer solutions on a client-to-client basis, thus being expensive and not viable for many small operators. Nuance's product is our biggest competitor, as its voice-to-text autofill feature inputs individual sections of the health record, but we compete by utilizing more efficient methods, which will be explained in the coming slides. Although these software competitors exist, doctors still spend an hour and a half on health records after work. The key difference between our company and the competition is being able to autofill entire pages of the patient encounter at once, ultimately minimizing the required number of clinicians.
EHR Boost's differentiation comes in the autofilling of history, present illness, integration with GoodRx, autofilling the billing information, autofilling diagnosis and prescription, and offering it to individuals. We have to compete with the legacy systems like Epic and Athena that have minimal automation, Phlebotics, which does EHR billing for only one hospital. EHR Boost's competitive advantages are: 1, the autofilling of the history of present illness using information from previous visits. Next, we will be autofilling prescriptions integrating with GoodRx, which will allow us to find the best prescribed medications in the area. Next, we will autofill the billing, generating insurance claims based on the information from the appointment. Next, we will autofill the diagnosis and create a plan for the patient based on everything we know about them. And finally, we will be offering this solution not only to the companies, but we will also deliver it directly to clinicians so they can quickly set it up if this is something they need urgently. EHR Boost's solution impacts start by giving better attention to the patients. As doctors spend less time looking at the screen, we'll spend more time looking at the patient and talking with them. Next, we're promoting clear healthcare communication through the patient, to the doctor, to the nurse, to the insurance company. Next, we will discover the reward of community collaboration as doctors work together to create the workflow of how health records should be filled out. Next, we will avoid burnout due to frustrating EHRs. And finally, we will be putting responsibility on the doctors to maintain and verify their correct treatment plans for each patient.
EHR Boost is a business-to-business software product. We operate with a freemium subscription model. We offer a free version of EHR Boost by which medical practices can explore how the product can improve their patient and doctor interaction. This free plan will grow the customer base and brand visibility as we transition their users to the premium version of the software. We offer a monthly subscription to providers at $25 per month and an annual subscription for clinics at $225 per provider per year. The subscription model plan will mean predictable revenue, which will assist in cash flow management and the day-to-day operations. The key costs associated with EHR Boost are legal costs at $5,000, software development costs of $100,000, customer acquisition costs at $10,000, and server costs of $1,800 per year to deliver the software to the customer. With an estimated 500 medical practices onboarded in the first year, EHR Boost is financially viable and profitable.
Our meaningful team consists of impactful individuals that have collectively come together with common interests to solve the problem of the tedious process of electronic health records. So starting off, I'm Dennett Leah. I deal with the public relations of the company. We have Jared Matthews. Andrews, who's the operations officer who specializes in developing company policies. Next up on the line, William Halbert, who leads the engineering department of the company. Moving on, we got Eddie Jung, who is a market analysis. Finally, in our lineup, Arnav Verma is a financial officer who is responsible for all financial aspects of the business.